Okay, perfect. So I hope everyone is still focused and with us. I see we've already been going at it for 50 minutes. I just want to start off by saying, give a brief introduction since it's been a while since we opened up the webinar. I work for Hyro. Hyro is a conversational AI company. And today I'm going to be talking about a free COVID-19 virtual assistant that we created to help healthcare organizations. And I'll break it down by first giving a tiny background about the company, going into the motivation behind why we developed this product, talking a little bit about the results of the campaign so far. It's actually still ongoing, of course. Unfortunately, it goes without saying, I wish COVID-19 didn't exist and we didn't have to do this campaign, but it is still in progress. And then I'll go a little bit into takeaways and what I thought were some effective things that we did, and piggyback a little bit already on some of the things that Tal spoke about and Olga as well, and go into branding and how I view brands today and what they can do to position themselves properly. Okay, so without further ado, I'll jump in. So again, we create plug and play conversational AI assistants. That could be a chatbot or a voice assistant or a virtual assistant. There are a lot of different names under the same umbrella, but essentially what I'm talking about is conversational interfaces. Most of those are on websites, but you can be on plenty of other mediums as well, such as call centers and apps. And the way we do that is by seamlessly ingesting information from a bunch of different data sources. So we're able to scrape data. We do that automatically, very quickly. We then translate it into a knowledge graph, which for those of you on the call who don't know what a knowledge graph is, it's imagine a web with a lot of different parameters and attributes that don't necessarily connect to each other, and we make those connections. We then add natural understanding layers, natural language understanding layers, and essentially that means that you can interact with that knowledge graph and that data with different phrasings and synonyms and in the manner that you wish to speak. And then we generate an assistant using one line of code for the client, so it's super easy to integrate, and voila, you have a conversational interface on your website. We're predominantly in healthcare, but we were working with a bunch of different verticals as well. It is pretty agnostic in terms of a solution. So now what does that have to do with COVID-19? Of course, in February, actually, one of our senior engineers said we should create a bot for the coronavirus. At that time, we have a lot of US clients in healthcare, and it hadn't really hit a big wave, but we knew that the threat existed, and we definitely kept it in mind. By March, we understood that we were going to do this. It wasn't a question of whether or not we would do it for free or if we charge. We knew 100%, it was almost like a reflex that we were going to give this away complimentary to healthcare organizations who are about to be swarmed, because of the current crisis. So by mid-March, we had already decided to do this, and it was about a 72-hour initiative in order to create it, and I'll get to that soon. Everyone has seen this graph. You're probably all sick of seeing this graph. It's pretty infamous, but the idea of flattening the curve and social distancing actually led to something in healthcare that was an overload for communication channels. Because of social distancing, people were less likely to go to their medical centers and their hospitals in order to get the information they needed, not just about COVID-19, but about a bunch of different patient services as well. And that would create a massive backlog in medical care, attention, and testing. And we knew that was coming because, again, we're in healthcare and we work with providers, and for us, the writing was on the wall. And also our virtual assistants that were already deployed, were beginning to get asked things about the coronavirus. Another motivating factor for us to create this was misinformation and fake news. So, we knew that because you have this disrupted relationship between healthcare and patients, and now there's long waiting times and people are looking everywhere for data on COVID-19, that misinformation would spread. So we wanted to get verified information to the people that need it most, citizens and patients alike. So we created a free COVID-19 virtual assistant. what it does is answer FAQs surrounding COVID-19 using natural language. So people can ask open-ended questions like, where can I get tested? How do I protect myself? What should I wear in order to mitigate the chance of getting it? Navigate patients to COVID-19 related website content. So a lot of the healthcare organizations that we were working with were starting to create their own content. They have specific testing centers. They have specific data for COVID-19 that they wanted us to integrate. And so we were able to navigate patients there. And then also provide information from verified sources, not your average Twitter user, but actually verified sources like the WHO and the Center for Disease Control, and give that to patients through a conversational interface. And the last thing is triage symptoms or do risk assessments. So we took the flow of the Center for Disease Control and we were able to make a conversational interface out of that, so that patients going into various healthcare websites would have a similar layout to what they'd see on CDC, and they could perform that risk assessment. So now comes the marketing aspect. So we decided extremely quickly to do this, to create this product, which required a lot of adjustment in terms of our content strategy, marketing in general, just a lot of things that we had in the pipeline that needed to go on hold, so we could adapt. We're a very small team. I didn't mention that before, but we're a small startup. So of course, doing all this work it really falls on one or two individuals in the marketing department. So so there was a lot of weight in terms of pivoting and creating this very quickly. And we were able to do that within 24 hours. Our website was completely overhauled exclusively for healthcare, and we had a COVID-19 landing page, and we had established a marketing campaign with a cadence. And all of this was messaging surrounding actionable assistance for COVID-19. So no hard sell. I think Tal mentioned it, spoke about it perfectly. Like not buy this or anything like that. Like, we have these capabilities and we want to give them to you for free. We want to support you. And these are our partners and clients and prospects anyway. So for us, this was important in terms of business relationships. The results are pretty crazy. So from March 18th to April 1st, I didn't pull the data from April for this specific webinar, but in those 13 days alone, out of Q1, 78% of our total marketing qualified leads came from this initiative. It was actually astounding, and I'll show the graph on the next slide, how we used a trifecta of marketing strategies at our disposal to really pump this out quickly and deploy just rapidly on a lot of different healthcare systems. 43% of our total website traffic was through the COVID-19 landing page on the entire quarter. Again, this is just 13 days. And 71% of all of total publications, articles, PR was surrounding this campaign. We didn't see a single result from paid social. Tried LinkedIn and it didn't work for us. And we just shut that down quickly and did all of this really. The only thing we paid for was a little bit of PR, and that generated non-paid pieces, which actually helped us in terms of ROI on the ones we did pay for. Email marketing is key, and hitting the right POCs, and also matching that with a strong outbound campaign. Again, messages that are super sincere and not salesy. And yeah, we saw higher conversion rates as well. So this is a graph. I didn't put our actual data as a company here. This is just to show in relative terms, a daily increase in marketing qualified leads. It went up 29x when we launched COVID-19. We're still seeing a heavy increase in marketing qualified leads. And that's, again, a lot of this is ripple effects that we're not paying for. It's organic at this point, through social media and through a lot of the PR that we've done. And this is an example of some of that PR and where we're at now. The video is perfect, purposely on mute, so don't worry about it. It's just to give you an idea of where we were published and and how critical this is for a company like us that's relatively new as a startup. So VoiceBot AI was organic, and VoiceBot AI are thought leaders in the voice industry, which is huge for us, being that we're in voice AI. And healthcare IT news as well is a case study that was done with one of our relationships, one of our hospitals. So all in all, the PR really helped us in order to garner traffic and lead to a lot of these deployments, which are directly related to those marketing materials and those marketing efforts. So for those of you on the in the webinar who know some health systems in the United States, we're very proud to be working with all of these. Montefiore is in New York, so especially as a New Yorker, we were proud to get them on board. Mercy Health, they're huge. And some of the takeaways from that campaign. So we prioritize relationship building over profits. I think that giving away the COVID-19 assistant, it's definitely an amazing product, I think, but for us, we have the capability to go much deeper in terms of technology. And this was something that we can deploy as a default for organizations that can help them immediately. And so for us, giving away that product for free was, again, a no-brainer, and we emphasized support over trying to bring in revenues at a time when we know that health systems are overtaxed as it is, and they're our primary prospects. We used PR as an effective tool, again, to gain credibility and traction. Agility was key for both product and marketing teams. We had a 72-hour turnaround in total in order to get the product out and already start marketing it. Strong partnerships were key. This is a time when businesses are more receptive to establishing those partnerships, to leaning on those partnerships. Everybody's hurting in one sense or another, so I think that was important for us, is to strengthen those partnerships, establish new ones. Hyper-specific blog posts relating to COVID-19 is also important for us to establish very quickly some kind of thought leadership. So we use data from our assistants and also from other sources. And email marketing, again, to the correct POCs with the right messaging, did really well for us. And beyond that, of course, consistent social media strategy to post and continue the hype. So that was the case study about our COVID-19 virtual assistant. And now I want to do just a small deep dive, just a couple of slides about branding in general and where I think I see Hyro and where maybe you might find your brand as well. And again, this is just one man's opinion, but first I'll start off with some facts. So there's a 12,000 person survey. This was conducted by Edelman in the last couple of weeks. And this is how respondents see brands during COVID-19. So this is, I think, beyond B2B or B2C, this is just in general how people perceive brands, how they're behaving during this crisis. 71% will lose trust in a brand forever if they perceive that brand as putting profit over people. So that right there tells you that, the messaging should be more about support than it should be to try and drive sales. 77% want brands to only speak about products in ways that show they're aware. 84% want brands, to help people, to address their products in a way that helps people throughout the pandemic. And 57% aren't so receptive to humor and lightheartedness, poking fun at the crisis itself. So I created this just for this webinar specifically, and I thought it was really interesting in terms of relevance, where you might find your brand today, and this is totally related to the context of COVID-19. So just it's not so relevant like your product is irrelevant or something like that. It's how does it relate to COVID-19, and how does it fit in the scheme of what's happening? So I think it's really about being honest and transparent and fixing your messaging to fit with that. I'll give you an example of relevance. Your product directly addresses the fight against COVID-19. So maybe you're creating masks, you're creating, your PRL, your hand sanitizer. Your product might address the side effects of COVID-19. So if you are Monday.com and you're giving, your tool at a discount to B2B to businesses that are working remotely and trying to manage projects remotely. That's a good example. Or kids are home from school. You have a product that can be refit to maybe deal with I don't know, entertainment for children. And then there's the other realm, which is your product just doesn't directly address the fight against COVID-19 or its side effects, which is okay, as well. And the difference between them is that if you're doing something that's related to COVID-19, your mindset should be to acquire. And that doesn't mean to sell, that doesn't mean to drive revenue. It means to start deploying, get more clients involved, get your product out there now. If you have a solution that's helping, then what you should be doing is sending supportive, concise style messaging. Think about the short term, try and get that product again to the people that need it right away. And the opportunity there is to gain trust, build strong bonds, establish credibility. If you're semi-relevant and trying to figure out the new normal kind of thing, so the mode should be to engage, be optimistic, helpful, empathetic. Depending on how this lasts, that could be short or long term, and depending on what you adapt or how you adopt, that could be things that are either pertinent to just the next couple of months or having your business forever changed. One example is digital transformation. So a lot of companies that never would have held meetings over Zoom are now doing that and might do that forever. Healthcare, telemedicine, a lot of hospitals that have never allowed doctors to do online appointments or virtual e-consultations are now transformed possibly forever. Not so relevant. So it's about education. Be on brand, be informative, and be aware. I think don't just ignore what's going on and continue to put out car ads. If you're going to continue advertising, great, but make sure that you acknowledge what's happening. The position is long. The idea is to weather the storm. But while you're doing that, it doesn't mean that there's nothing to accomplish. Tal spoke about this a lot, and I think it was a great point, that the idea is to build a great content library, to do things you've never done, to generate awareness. If you're a mom and pop bookshop, you can do virtual book club. There are so many ideas, so many ways that you can adjust and adapt your content for this. There's a lot of noise in terms of webinars, sure, but the noise level from competition is also down in the sense that advertising costs, have changed and competitors are advertising less. It means you can compete for that mind share. So some examples, just companies that might have been not so relevant but became relevant. Braun took their hockey masks and they started to make medical face shields. Semi-relevant, people are home now with their families, and experiences that used to drive weekends and that kind of thing are now few and far between. And so a great example is Milwaukee Food Tours. They used to do local experiences, local tours, and now they've gone virtual. They were a business that was totally physical, and now everything is about delivering it to your door. And obviously the travel industry has been hit so hard, and they're not exactly relevant right now, considering the state of things. But Viator and Airbnb are offering virtual tours, so they're driving kind of this travel education about really obscure, amazing places all around the world, and getting people hyped for in the long term when travel comes back, and then they can actually visit these places. This is the last slide. It's just something to keep in mind is occasionally brands get it wrong. So I put an example here that got a lot of negative press, which was BMW kind of making light of the idea of outbreak and saying how, or insinuating how buying a BMW can help flatten the curve. So this wasn't such a hot idea. And again, this is about kind of knowing where you are in that sphere and adjusting accordingly and making your messaging sound to fit with that. It doesn't mean you have to stay in your lane if you can innovate and break out and become relevant, like a Braun creating face masks. But yeah, really try to know where you are and adjust accordingly, I think is the main idea. That's it for my talk. I hope it was interesting for you. And then if you want to reach out, about conversational AI or any of the things that we're doing, if you know a hospital that needs a virtual assistant for COVID-19, of course, it's Aaron at Hyro AI. So thanks.